Dr. Beck, I want to talk about fibromyalgia, something which, a nerve specialist like you, an MD, is that something you treat? Is that something you can fix?
Yes, we do. In addition to diagnosing and treating problems with the nerves, we see a lot of people with muscle complaints, and we do a lot of treatment geared toward muscle pain and also the pain of fibromyalgia, which frequently affects the muscles.
I see. So tell us a little bit about, fibromyalgia. What is it? How do we somehow detect it, and what are the treatments? Because apparently people are running around thinking that that's it. It's over. It's just getting worse.
Fibromyalgia is what's called a rheumatological condition. You've heard of rheumatoid arthritis. This is a condition that's sort of all over, and it affects primarily the muscles. And there's a specific set of criteria that you have to go through to identify or diagnose fibromyalgia, and this is put out by the American College of Rheumatology. And there's several different criteria you have to meet, but the big thing is people have to have diffuse muscle pain. This is basically muscle pain from head to toe. And there's a specific number of tender points that you have to score on, and there's a few other symptoms that people typically have, such as fatigue and things of that nature that go with the fibromyalgia. And it's very important to make that diagnosis because there's many other conditions that can mimic fibromyalgia, which are treated quite a bit differently. So, again, as we always say, start out with a good history and physical examination with your doctor.
Got it. And so go ahead and tell us a little bit about some of the treatments of fibromyalgia.
Fibromyalgia is really common, and it's frequently a long-term problem. And so we really look at treatment in a long-term manner. And again, as I always harp on, the exercise is very important. Now, in fibromyalgia, you have to do exercise a little bit more judiciously. If you do too much, it can make you worse. And so we frequently use pool therapy with our fibromyalgia patients to help reduce their pain, which is a lot more gentle. It's a little less stressful for them, and people really tolerate it much better. So that's really my key cornerstone of treatment is pool therapy in a heated pool. And people sometimes just do fantastic with this treatment when they really failed in a lot of other physical therapy programs. So you really need to have people, both the doctor and therapist, that are familiar with the condition to treat it appropriately. Now, the other thing is there are many medications that people use. We try to stay away from drugs like narcotics and things of that nature for treating this problem because it is a long-term problem, and most people don't really want to take narcotics on a long-term basis because they are habit-forming, and once you start those type of medications, it's very difficult to get off of them. So we rely on what we call adjunctive medicines or additional medicines, such as antidepressants. Now, we give those to patients, and we don't think you're crazy or the pain's all in your head. What we do know from medical research is that antidepressants are probably one of the most effective medications to give people with fibromyalgia. So if your doctor or I suggest those type of medications, we're not trying to, put off your pain or suggest your pain's in your head. It's just that that's a very effective treatment. So that's one of the first lines. There's other milder pain medications you can use, such as anti-inflammatories. There's another drug called tramadol or Ultram, which is not an anti-inflammatory, so it doesn't hurt your stomach. It's not a narcotic, so it's not considered to be habit-forming, but it's very effective for pain relief, and so we frequently use that medication as well.
Okay. Any natural remedies out there which don't involve drugs at all, rather than the exercise, and in this case the warm pool exercise, but anything else? Like in certain inflammatories which are completely natural, homeopathic or whatever?
Well, a really smart diet is a good place to start, avoiding really a lot of red meat, really fatty foods. Some people take blue-green algae as a supplement to help with fibromyalgia, and so this is another thing that you could look at. Is there's a large number of herbal remedies. Although I'm not an herbologist or herbologist, but there are some things that I am familiar with that we can suggest if you're looking for those type of alternatives to medications.
Right. Okay. And what would you say in terms of like success rate? And can people actually contain it to a level where they can again function? Is that something you think can be definitely done in most cases?
Well, I think I think that's a good way of putting it. We're not necessarily going to get rid of it. It's unfortunately a really long-term problem in many cases. What we're trying to do is manage the ups and downs with it. And, you're having good days one day and bad days the next. And so what we're trying to do is give you tools to handle the bad days so that you can get through your life and do the things you want to do. And so this is where home exercises, good aerobic conditioning, judicious use of medications can help you kind of get through the bad spots. And then some days are going to be good. But overall, things will likely improve with good exercise, particularly pool therapy and medications. But it unfortunately probably will not go away.
Got it. But it can be put to a level where life is still worth living.
Yeah, in many cases it can be, and that's something we really focus on, is really making sure your quality of life is good.
Okay. Well, all right. And the nerves play, that whole thing has to do with nerves. So going to a nerve doctor like you is a good start, right? Or not? Am I wrong there?
It is. We can make sure that you don't have some other muscular disease that's causing the problems, and this is something else we specialize. It's nerve and muscle testing, and by looking at things, we may need to do laboratory tests to make sure you don't have a primary thyroid problem that's causing your muscle pain. There's many medical conditions that can cause muscle pain that are not related to fibromyalgia, and we really want to make sure you don't get slip under the radar, so to speak, and have those missed.
Okay. All right. Thanks for your candidness. Bye-bye.